let's take a look at this SNAP Concussion product. So here's the box when you get it. All right, nice, welcome to SNAP. Very easy QR code right away to go ahead and get started with your training. And it comes with this nice case. All right, so here's the SNAP equipment. Comes in this nice shell case. This is a nice feature with this expensive equipment is it won't just let you open it. There's like a safety buckle to make sure your product stays safe. All right. It's a very nice, robust case, something that is really gonna be able to take a drop or a fall if you were to take it on the sideline or moving it around in clinic, so that's nice. All right, it comes with some basic alcohol wipes here, obviously keep things sanitary. Comes with a nice power cord, and then obviously the device here. Okay. So the form factor of this is really small and compact. You can see how this is going to be really usable. You got the viewing lens here. Okay. You're going to have a screen here to input some information for the patient and then to likely start the test. And I'll give you a real life demo of this in a little bit. All right. Pretty compact, well put together. You can tell it's really robust. And it looks like it's built to last. All right. All right, so now we're at snapconcussion.com/training. So this is where you log in for the training, right? So we'll go to complete our login. All right, so you'll come to your dashboard and you can go to training here, which will have your concussion training, or it looks like you can just hit your training here in the home screen and it'll take you there as well. All right, so you have your demo video about what SNAP is.
A portable 90-second concussion test built for the clinic and the sideline. SNAP provides results in under 2 minutes, enabling immediate concussion diagnosis after a hit to the head. To perform a scan, enter the patient's information and symptoms directly into the device. SNAP tracks eye movements while the patient watches a short video, capturing subtle indicators that may be invisible to the naked eye. The SNAP score combines this eye tracking data with reported symptoms to help medical professionals determine the presence or absence of a concussion. SNAP is FDA cleared to diagnose concussion with 90% sensitivity and 94% specificity, and to assist you with the return to activity decision. Learn more on our SNAP training page. SNAP by Oculogica.
Okay, there's a demo video. Now let's just go into the training. So let me walk you through this. All right, so nice little training page. All right, when you go ahead and open up and turn on the device, looks like you're gonna be prompted to create a PIN, connect to Wi-Fi so you can upload your scans and then install any updates that are available. Yep, simple information on how to charge it, power button, very straightforward. Explains what it is. And I think this is really, really important here, the second bullet. It's FDA cleared for ages 15 to 25 within 3 days of injury as part of a multimodal assessment. So looking at using it in those age demographics within 3 days of injury is where you get that 90 to 94%, the sensitivity and specificity, as they mentioned, which is tremendous accuracy. It's not been tested on individuals who are intoxicated, have ADHD, vision worse than 20/80, CT scan positive for brain injury, such as like a brain bleed. History of strabismus, which is an eye alignment issue. Diplopia, which is double vision. Amblyopia, which is poor eye positioning. Any cranial nerve palsies or other ocular motor conditions, right? So it's important to know a good history of that patient, because if they do have significant strabismus and we're getting a poor concussion test, well, that's where we're going to have to lean on our multimodal assessment rather than just taking what the test is giving us. We always want to look at a multimodal assessment, but sometimes these small eye movements that the SNAP device is going to help us see is something that's really difficult to see in a bedside exam. So this is really going to enforce your clinical exam. All right. So after this, they had you take a little quiz on the information. I already passed that, so we're going to go on to the next one. So this is the operating screen on the device. Quiz questions. A clinician wants to rescan a patient who was tested last week. Which of the following is true about rescanning? You have to enter symptoms every time. For every new scan, we want to go ahead and make sure we're entering symptoms. What do patients need to remove in order to take the SNAP test? We'll want to remove glasses. Okay, got to make sure it's fitting tight up on your eyes so we can see that. The SNAP score is calculated immediately after the test and can be viewed on the device. Okay. SNAP report, let's go through this. There'll be more information on that. We can walk you through that. So what is the SNAP score? Looks like it's a multimodal comprised of eye tracking metrics and symptom severity, right? That's why you have to put your symptoms in every time. It's adjusted for patient sex, and then it ranges from 0 to 10, which is normal, and above 10 looks like it's abnormal findings based on their sensitivity and specificity scores. So where it's showing on the graph is basically it's doing a quadrant scan and it's measuring your pupil position. It shows your pupil path for each eye across 2 stimulus cycles, so it goes through that 2 times. Some missing data from a closed eye or eye makeup, something that's obstructing the camera. Looks like that's going to be the gaps you're going to see over here. Any valid scans show a square-shaped pattern following the stimulus pathway. Okay. Pupil size plotted over time. Right eye is red line, left eye is blue line. Okay, makes sense. Pupil sizes remain the same throughout the test. Normal, abnormal, you're going to see gapping between lines showing difference in pupil size, which is going to be your eye is basically trying to regulate light, which may be a sign of some autonomic dysfunction from the concussion potentially. Visual tracking. Difference in eye velocity. Horizontal movements are in blue. Vertical eye movements are in that magenta or pink. Obviously, they should pair together pretty well. If we're getting this binocular presentation where the left eye is doing something different or we're struggling more in the horizontal versus vertical planes, that would be signs that would be consistent with concussion. Yeah, so you can see how everything's within kind of that gray presentation of that normal range. You see this big scoping presentation here as far as abnormal eye control outside of that gray normal range, which would be signs of a concussion. Okay, that makes complete sense. Saccades are those quick and accurate kind of jumping eye movements that we're going to do all day. Shows the direction and magnitude of each saccade plotted from the center outward. Okay, so we got the red. The red is the right eye, the blue is the left eye. Hypometric saccade, so you're undershooting. Hypermetric means you're overshooting your target. What these pages show, each patient metric compared to approximately 1,000 healthy, uninjured individuals. Okay, normative comparison. They're adjusted for sex for every metric. Okay, that's great. And then you can access your scans. You can see up here in the top, you got the home. We're in the training section. You can hit select scans and you're going to see all the ones that you've performed already. All right. 15-year-old patient scores a 7.2. Which statement is correct? 10 was our cutoff, remember? Any score above 5 indicates concussion? No. Negative, but the SNAP score cannot be used as a sole diagnostic measure? Yes. No other tests are needed. We always want to do it part of a multimodal exam. So 7.2 should be under the 10, which should classify as negative or passing. All right, we passed. Scans here. We don't have any scans in yet, so let me do myself. See what we find. All right, so before you start it, comes in here, it tells you to remove the glasses. You're gonna seat the patient, hand them the SNAP unit so they're looking through it so they can see the video, and then you're gonna tap go. All right, so we're gonna start Ty. So he wants to slide it up on your head a little bit. There we go. Keep eyes steady. Make sure his eyes are in view of the camera. You see how the yellow box is tracking his pupil and how much time's remaining again. So you're gonna be able to see his eyes, and then obviously if you need to stop the test, you can do that.